Being able to guess what is happening is really good to give your owner something to hold on to as you explain the symptoms that can be managed, which ones need more intensive care, and which ones might need surgery. This is also really helpful to start the owner with what to expect at the referral hospital. You, the veterinarian, will then call that hospital and give them the heads up that this case is being referred with as much client information, history, treatments, and any other information that might be relevant. This is also a good time to check in about the costs and estimates with a rough idea on the procedure that they might be doing or any other relevant information for the owner to know. And the client, in the meantime, should be preparing their trailer, phoning friends and family for help, and figuring out their financial situation. Unfortunately, there is no way to take money out of these conversations. And the more we can do to educate and comfort our clients, the smoother this whole process will be, because we know that tensions and stress is high. We need to get that horse onto the trailer and get him to the hospital as safely as possible. This will usually mean a lot of sedation and topping up the analgesics. It's a perfect time as well to use a combination of that intravenous and intramuscular dosing that we talked about earlier. You can give half the dose of IV and you can give the other half IM, and this will give you a good hour or two of sedation. I've also had a lot of luck with some ketamine in horses that are very painful while trying to load. This gives you about 15 minutes of additional analgesic effect if you use a very low dose, and I mean 1 or 2 mils max. Sometimes that's enough to settle them down to get them loaded. Using a CRI or a drip is also possible once the horse is in the trailer, or if you have the horse hospitalized under close supervision. The CRI might include ditomidine, butorphanol, or even ketamine, but the issue is that a technician or a veterinarian should be with the horse monitoring this drip, which becomes very dangerous in a trailer. So I don't recommend this unless absolutely necessary, but I do mention it here for you to know as an option for hospitalized cases. And when reflux is present, I would recommend leaving the nasogastric tube in place and tying it to the halter with some rope made out of a piece of white tape or some twine. I also then use a muzzle over the nose to prevent the horse from rubbing that tube out. Another pre-referral treatment might be some antibiotics that the surgeon might have asked you to give prior to surgery. But whatever you end up doing, I advise that horses not be tied up in the trailer. This is in case they begin colic again and go down, which will inevitably lead to more serious injury and complicate that horse getting out safely once at the hospital. Blankets similarly can get tangled, so avoid these if possible unless it's really cold outside. In summary, remember to refer these cases sooner rather than later whenever possible. If you're in the field, hours from anywhere, you may want to refer anything that isn't a straightforward case, or if you think that repeated treatments are necessary. Referral and hospitalization are expensive, and surgery is even more expensive. We cannot separate finances from care at this time, so please make sure that you've had this frank conversation with your clients before they get referred, whenever possible. Similarly, the more information you can share with the surgeon, the better, because then they can prepare for that case and treat that horse efficiently upon arrival. Giving some extra analgesics and sedatives will help that trailer ride go more smoothly, and the nasogastric tube is great because once the horse is unloaded, we can decompress the stomach without additional sedation or stress to all involved. Finally, please have your owner prepared with a trailer or another means of transportation. Make sure they've contacted their insurance as soon as possible and give them a list of the current findings and what to tell the referral hospital.